Hiya, Alison.
Hi, Paula.
Thanks for joining me this afternoon. It's great to have a conversation with you about the work that we've been doing at the NMC, developing additional regulation of advanced practice through the Advanced Practice Review, which I know you know all about because you sit on our steering group. So you've been a key part of all of the work that we've done. So it's really great to meet with you this afternoon.
It's great to be here.
I wonder, Alison, if you can just tell us a bit about yourself, what your role is, the work that you're involved in, and how you've been involved with the review of advanced practice.
Yeah, sure. I'm a professor of healthcare and workforce modelling at London South Bank University. I'm also the director of the ICNO for the Queen's Institute for Community Nursing. So we do quite a lot of research in terms of advanced practice, both in any setting, actually. I'm also the deputy president of the Royal College of Nursing, and I've been sitting on the steering committee in a kind of mixture of those roles, I guess, and those perspectives.
That's brilliant. Thank you so much. So yeah, some really key insights that you bring to the work that we've been doing and hopefully to the conversation today. So thank you. Um, I just wondered what you thought about what the NMC is doing in terms of developing additional regulation for advanced practice. So I guess I'm primarily thinking about the role of the professional regulator and in protecting the public.
I think at this point, it's actually really now essential to regulate advanced practice. I think historically, kind of gone back and forth on that. Is it necessary? Would the code cover practice? But the mass expansion of advanced practice roles, particularly with a plethora of employers, I think introduces a nuance to the risk to the public, if I am honest. And therefore, I think now is the right time to regulate advanced practice.
Yeah, that's brilliant. I think you're right, and that's something that we've heard throughout all of the work that we've been doing when we were engaging with stakeholders. Is that the role, particularly within nursing, has grown organically, and people have developed it in whichever way they thought appropriate for their particular setting. But yeah, it feels like the right time, and we've been talking about it, I think, for about 30 years, haven't we? Um, we've I think somebody said we've been on this bus 26 times, and it's time number 27. We need to get it right. It's only going to get more challenging.
Yeah, I mean, I think the previous ways that this has been looked at is really as a professional issue, recognition of advanced practice. I think now, though, is that there's much more emphasis on risk to the public. Certainly, when we published our research in 2017, we found people with titles like clinical nurse specialist and advanced nurse practitioner who had no registration or nursing qualifications. And then when we looked at coroner's prevention of future death notices a few years ago, we also found what was termed advanced practice cropping up in those. And so for me, there is now a real kind of need in terms of defining advanced practice, which has kind of been done professionally, but I think needs to be done now in a regulatory framework.
Yeah, I think you're absolutely right, and you bring up the kind of coroner's reports and the comments that actually there is no benchmark or standard, is there? And we've found that challenge ourselves. I mean, obviously we didn't until I started this work 18 months ago in terms of fitness to practice. We didn't collect an awful lot of data around advanced practice then. We've begun to start collecting some of that information now, and that there are those gaps, aren't there, which all add to the risk. So yeah, I think we all feel that now is definitely the right time in terms of public protection. um I wonder, Alison, we obviously have developed principles for advanced practice, which you've been a key part of as a member of our steering group. And we've worked across the 4 countries of the UK to develop those, to align them with the 4-country advanced practice frameworks, which are already in place. And as you know, some of those are multi-professional, so England and Wales, but some are just for nursing, which is Northern Ireland and Scotland. And we're planning on publishing those principles in early June. So I just wondered what your thoughts were around the principles and introducing the principles and what that will mean for advanced practice.
I think the principles are a really good idea, and certainly they lay the foundations for regulation. The reason I think they're a really good idea is because they're going to start to bring some consistency. We do have the 4 frameworks, but of course they're just for mostly NHS employers. Lots of people termed advanced practice professionals are actually not employed in the NHS.
Yeah.
And we have no idea really about that group of people. We know about some of them, but it's still a bit of a mystery. We also know that in some areas that are very high risk, people are calling themselves advanced practice professionals, or rather, employers are conferring that title on them without any advanced practice qualifications or postgraduate qualifications. And that means there's real inconsistency. One of the things I really like about the principles is it sets some expectations for registrants, but I like the fact that they really start to set expectations for employers and organisations who might either utilise advanced practice professionals, advanced practice nurses and midwives, or employ them. I think there's a real lack of understanding, particularly in some sectors, some high risk sectors. For example, independent providers in mental health services and areas like prison service, where there is such a variety of what's termed advanced practice. This will really help those employers provide that consistency.
Yeah, that's really helpful, and it kind of confirms again what we've heard from stakeholders throughout the review, doesn't it? That there is that variability and that inconsistency, and like you, for me, that those principles for employers will really help those ones who perhaps don't have the governance processes in place. Some have done it really well and got them really well established. But in other places, like you mentioned, the independent providers, primary care, prison service, it really helps them to start to think about what their advanced practice workforce needs in terms of support and how they can build that governance around that workforce. So yeah, completely agree with you on that one. But you're right. Our principles are the foundation of the work. They're the broad kind of high level statements of our expectations as a professional regulator. But of course, there's a lot more work to do. They are one part of the puzzle, and the rest of the work that we've got yet to do is develop those standards of proficiency. So what an advanced level nurse or midwife should be able to do. And then those associated education program standards, so that in the future, anyone who wants to be practicing, working at an advanced level will need to have completed a program of study that meets those standards and is approved by us. And then, of course, there's the current workforce, like me, who practices in general practice, but who the future standards won't touch. So there's that developing that transition process, which is proportionate to the level of risk and recognises the skills and capabilities of the workforce that are out there. And I think that's no small feat. It's probably the trickiest part of the work. I say that now, I might change my mind, but it is a really complex piece of work to get that right, because, you know, you mentioned kind of knowing where advanced practitioners work. We don't know that at the moment, and we estimate that there's around 40 to 50,000. But how do we manage that transition piece and learn from others who are perhaps in that space at the moment? So I think that's really important.
So I really like the fact that the principles actually focus on a level of practice and not a job title. What we've seen over the last few years, I mean, advanced practice in nursing has been around for decades. If you count district nursing in that, it's 150 years. It's been around for a very long time.
Yeah.
We've seen a more medical model perhaps favoured in the last particularly 10 years with the rise of ACP. But of course, that's not the entirety of advanced practice. And I really like the fact that the principles focus on risk and complexity in nursing midwifery practice, and not merely a kind of substitution or doing the work that doctors used to do, task shifting kind of approach. It aligns very well, I think, with the RCN's level of practice, and that I think is something that we've really missed in the UK, is that consistency across the profession. No matter what kind of job you do, what kind of role you do, how does that align to a level of practice that can be regulated? And I think this is kind of the missing link.
Yeah, I think you're right. And you know, we were very clear that we wanted to focus on a level of practice, and it does nicely align with the work that the RCN is doing, which is really helpful. And I think as you were talking around medical substitution, one thing that came through loud and clear that we heard from professions was that professional identity. And, you know, we heard it loud and clear from midwives. I'm a maxi midwife, not a mini doctor. And similarly from nurses, but in many ways, that's how the kind of the role originated, was, I guess, taking on some of the responsibilities and tasks, if we're allowed to say tasks, although that's a dirty word, from medical colleagues. But it's a completely different situation now, isn't it? It's about developing nursing roles in such a way that we are recognising the profession and the skills and the abilities and the contribution that they're making to patient care.
Absolutely. I mean, I'm thinking about Jane Ball's work. It's 20 years old now. The maxi nurses, not mini doctors' work.
Yeah.
And I mean, task isn't a dirty word. The issue with task is that it's used to describe the entirety of work.
Yeah.
Without praxis. So although professionals might share, for example, prescribing, they might share jurisdiction on that. Both different groups of people might prescribe. They are looking for a different professional lens.
Yeah, absolutely.
Those different professional lenses together really add to patient experience, patient safety. Once we start dividing work up into tasks and saying this task belongs to this profession, this task belongs to this profession, then we lose some of that.
Yeah, absolutely.
Praxis is the thing that helps us manage risk.
Yeah, absolutely. Thanks for that, Alison. I wondered if we could move on a little bit to you. You'll know that we've worked really hard. We have set up a public advisory group that's been instrumental in helping us to progress the work. They're really quite a vocal group. They really hold me and my co-chair to account, which is great. It's exactly what we need, and I love the challenge. It's one of my favourite groups to meet with. And we've been developing what we're calling a public first or a public facing definition, and they've really led that. And that's primarily because I took a professional definition to a meeting with them and said, we need to develop a definition. How does this feel? And they laughed at me and said, we don't have a clue what you're talking about. So I set them the task of developing their own definition, and then we tested it out with members of the public, with charity and advocacy groups, and within other networks to get a sense of how it felt to the public. So I just wondered what your thoughts are on the definition of advanced practice. And I know within the principles we've got a professional definition because there are nuances that the professionals want to see within that definition. But we've also got the public definition. And I just wondered what your thoughts are on those definitions.
The professional one, I think, really does emphasise the risk and complexity. So as a researcher, as a modeller, what I'm looking at about different kinds of work and different kinds of workers is the risk and complexity, and how often do they have to deviate from protocol? When do they have to make that judgment? And that's, to me, is what advanced practice is. So it's about being able to hold that level of risk. The public definition, I think, is a lot more concise, and very, very helpful. It's a lot clearer to the public. I think the issue with advanced practice is going to be for the public that there is a different level of practice, which they perhaps haven't appreciated in the past.
Yeah.
Most members of the public see someone in front of them that can hopefully help them.
Yeah.
And what we do know from research is that, to be honest, people generally in the public don't really care who's treating them as long as they're being treated successfully until something goes wrong.
Yeah.
Then they very much care about the person's professional background and qualifications. And so I think this definition will be really, really helpful to the public, just to distinguish that there is a different level of accountability in terms of regulation.
Yeah, absolutely. And there's a whole other piece of work which will sit around this, which is again come through those conversations with the public advisory group, that, distinguishing between different levels, as you say, but also the different roles. So what distinguishes a registered nurse from an advanced level nurse, from a consultant level nurse? So there's another whole piece of work around that will be progressing as well. So yeah, really helpful.
I'm sorry.
No, you carry on.
I also think the public definition will help some types of employers.
Yeah.
It's quite interesting when you look at who employs nurses and midwives and health visitors these days. They're not always employers that are familiar with practice.
Yeah.
And certainly we see some employers who perhaps not traditional employers in healthcare. So, for example, local authorities are employing nurses but perhaps don't quite realise the nuance of a professionally registered, accountable type of worker. And so I think this will help with some of those employers too.
Yeah, really, really important points, Alison. So yeah, thank you. I wondered, we've talked a lot about opportunities, but I wondered if you could share your thoughts on any further opportunities with the work that we're doing, but also some of the challenges that you see with additional regulation, and potentially with the principles specifically.
For me, the biggest opportunity, particularly as a workforce modeller, is consistency. So at the moment, we're dealing with a workforce, one of the only safety critical workforces in the world, I think, where we don't really understand it fully. And there is no common standard.
Yeah.
And that, for me, is going to be incredibly helpful. And I think it's going to be incredibly helpful to employers. I think it will cause challenges at first, but I also think that will eventually actually benefit employers. Employers will be able to have confidence in the people that they are employing, particularly to do more complex risk-holding work. So for me, that's one of the really big opportunities that might not be one of the most obvious ones.
Yeah, no, I think that's really important, and we heard from lots of advanced practice nurses themselves and midwives saying that it will give them a voice to be able to say, this is my professional regulators' expectations and standards, and this is what I need from you as my employer to support me. So yeah,
absolutely. I think in terms of expectations of employers, this will really set a standard too, and certainly work towards it. And again, I think, pragmatically, there might be some challenges with that at first. But if we think about the ultimate aim of this is about public protection, then I think that's a journey worth taking, as we would in any other safety critical industry. So having consistency, standards, understanding of the work, recognition of the work. So we always think about respect, reward, and recognition. But recognition of this work is also important, because if you are then designing the workforce, or if if you're going to commission a new service and you want to think about what kind of workforce you need,
Yeah.
this will really help give a much more sort of intelligence driven design to that workforce, rather than kind of, as workforces do quite often in healthcare now, just evolving, sometimes successfully and sometimes not so much.
Yeah, yeah, absolutely. I think really, really important points around kind of, workforce and future workforce, which is really fabulous. So, thank you, Alison. You've probably drawn us to a nice close there, but it's been really great to speak to you and hear your thoughts, and gather your experience and expertise into this conversation. So I'm really looking forward to continuing to work with you as we progress through the other pieces of the jigsaw puzzle until we do get to that additional regulation. But yeah, it's been really great this afternoon. So thank you.
Thanks, Paula.